90% of Cambodian women will suffer from a long-term infection during their lifetime. Due to extremely poor diet and insufficient healthcare facilities available to Cambodians, women in particular may stand in enormous lines for hours, often never receiving medical treatment. Without seeing a physician, these women will likely have slow and painful deaths.
Doctor come usually come on the morning, from Monday to Friday.
Yes.
But come very quickly. Even they ask them, oh, you get better? How about you tonight, last night? And they go away, they don't waiting for listen the answer.
The creation of the Nokor Women's Hospital is the start of a long-term plan to create better healthcare for all Cambodians. But as the least cared-for section of the community, we recognise women's importance as mainstay of the family and as the principal caregiver themselves.
Women is a pillar of the whole family. She is the pillar for stability of the family. If you have a woman who is sick, who cannot take care of the whole family, this family is destabilized.
You lose a woman, you actually lose a family, and you lose part of the fabric of society.
The gender norms and tradition still keep women as the last person to go. If the whole family is sick, women is still the last person to go to the health center. And when she is in the health center, sometimes it's too late already. And we need to do something for women. They need to be healthy. They need to have the access to health center. They need to get information on time and to treat themselves.
The average life expectancy of a Cambodian woman is 49 years, and with a government health expenditure of just $2 per person, less than 5% of rural women have access to any kind of medical care. Even if they have the means to seek help, women over 50 with cancer will automatically not be treated. These statistics are quite disturbing, but they don't give the full sense of hopelessness most women feel.
Poor people don't have money and they don't have access. To get medical care, you have to pay in Cambodia. There's a couple of NGOs that run charitable hospitals, but they're so overwhelmed that people stand in a line and they actually have a lottery, where they have to pick a number. If your number comes up, you get lucky, and if it doesn't, too bad.
Although the need for a hospital is obvious, just as important is how it will operate in the future and sustain itself without more aid.
We have patients who can afford, but unfortunately they don't find any good hospital, local hospital, who can really deliver such service they expect to get. So if this hospital is has a good reputation, in 2 or 3 years, other patients who can afford can be interested to come in. They are not willing to go abroad, for treatment if they can find something here.
For the very poorest, there is a very minimal charge, maybe 50 cents or $1. But we also want to make sure it's financially sustainable, so the vision is to open it up for people who are wealthy, ex-foreigners like myself. So rather than going to Thailand or to Singapore for checkups, they can actually come to the hospital. And that will help finance the running of the hospital in future years.
This is the way how we are seeing to maintain this hospital self-sufficient, not just relying on external budget.
The project is already up and running. 2 hectares of prime industrial land in the heart of Phnom Penh have already been donated, and the architectural drawings have been drafted and approved. The cost of the hospital is $5.5 million, and we understand that is a vast sum. However, finding 50,000 individuals to donate $100, or say 125 corporations to donate $25,000, then the hospital will meet its proposed build start date of January 2012, with around 18 months to complete.
I would love to see Nokor built by individuals, I'd love to see a wall written with all the names of all the people that stand with the women of Cambodia. I can imagine being a Cambodian woman living in one of the villages, very poor, walking into a space and then looking up on a wall and seeing all the names of all these people who believe in her and who've done this because of her. And I can't think of a greater way to build the hospital and to equip it and things like that.